Hi, welcome to Physio4U Podcast, episode 8. Today's title is Erectile Dysfunction. It's not just plumbing, it's brain, body, and connection. Let's see. What if I told you erectile dysfunction is rarely just about blood flow? For years, we have treated ED like a mechanical problem. Fix the plumbing, fix the performance. But the truth, that approach is incomplete. And for many men, it's why they are still struggling. Together, today, we are going deeper. Because erections are not just physical. They are neurological, emotional, and relational. And if we don't treat the full system, we miss the solution. So, let's reframe ED. Let's simplify this. Erectile dysfunction is not just a body problem. It's a biopsychosocial condition. That means your body, your brain, and your relationships all working together, or sometimes working against you. So a powerful review by Michael S. Allen and colleagues in 2023 showed something very important. Psychological factors are not secondary. They are central to how ED starts, continues, and even worsens relationships for you. So, here's a key takeaway. Medication alone is often not enough. The best outcomes happen when we combine physical and psychological care. So, what are the 3 layers of ED? Let's break this into something practical. Number 1 layer is the triads. Your baseline wiring, that's called the triads. Some men are naturally more prone due to higher stress sensitivity, personality traits like anxiety, and poor lifestyle habits over time. We need to definitely look into that. The second layer is states. That means what's happening right now, what state of mind you are in, how much stress do you have, what kind of burnout you have. Stress, burnout, and depression, they all come under the states. This can literally switch off the system needed for an erection. So the third layer is moments, the real game changer. So this is the one people often miss. So this is the moment when performance anxiety sets in. That one thought during intimacy, will this work? That thought itself can kill your erection. That single moment can shut down an otherwise healthy system. But here's the good news. This is highly treatable. So let's discuss the relationship impact. ED just does not affect function, it affects your identity. Men often feel less confident, ashamed, and isolated. Their partners may feel rejected, unwanted, confused, and this creates a loop, a cycle where both people pull away, making the condition worse. That's why treating ED in isolation rarely works. We see a lot of men in the clinic with ED problems. We do bring their partners in for kind of a combined therapy. It really helps. So, what actually works? What is the evidence-based shift we are looking at in treating ED? Okay, this is where our practice needs to change. Research consistently shows pills plus therapy is much more beneficial than pills alone. So, when we combine medical support, psychological strategies, and pelvic floor rehabilitation approaches, we get better, more lasting outcomes. And this is where pelvic floor physiotherapy plays a very powerful role. So, what we are doing differently as a physiotherapist, as a pelvic floor physiotherapist, and treating male pelvic pain for over a couple of decades. We've done several courses using a lot of advanced therapy systems and evidence-based practice approaches. We screen every patient beyond the physical. We ask about stress, mood, anxiety, partner dynamics, lifestyle habits, sleep, nutrition, social life, everything. And also we treat performance anxiety directly using different breathing strategies to enhance your parasympathetic nervous system, to reduce your vagal tone. We formulate mindfulness techniques. We use graded motor imagery techniques. We use attention retraining, and also we go through cognitive functional therapy using a lot of gradual exposure techniques actually. So we also bring the partner sometimes into the process if needed and if it's okay with the other partner. Sometimes one conversation together can break the entire cycle. And also, we always think about team-based care. So we collaborate with physicians, your urologist, psychologist, physiotherapist, massage therapist, chiropractor, occupational therapist, rehab professionals, because ED is never just one system. So I have done many courses with IPC. One interesting thing what we learned in IPC is that we call it the Happy Male Screen. Happy Male spelled as HAPPIMALE. It's basically a synonym for the framework. It's a simple framework we developed to do a quick psychosocial screen that helps you uncover the hidden drivers of ED. So, what does it stand for? The H stands for history. We go through detailed history of our patient, any trauma or past experience affecting intimacy. Then the A and P in the Happy Male stands for attitude and perception. So we go through performance anxiety questions, intrusive thoughts, anything which affects ED. Next, the P and I stands for partner and intimacy. So we discuss about the relationship dynamics, the psychosocial aspect behind that, the avoidance patterns with the patient and also partner if needed. And the M and A stands for mood and anxiety. So we talk about the depression, medication, stress, work stress, life stress, kid stress, everything, and also the emotional health. And the L in the Happy Male, we talk about the lifestyle. That's where the sleep, the exercises, physical activities, smoking, alcohol, spine care, back pain, everything comes into matter. Do not forget your spine in your ED. All your nerves controls your erection. It's there in your lower back and your sacral area. You know how many men we have treated for ED? They got better just by working in the lower back? You'll be surprised. There's a big spine component there. So we'll discuss that more when we meet or when you have more questions. And the E, the last letter in the Happy Male, stands for environment. So that's when we talk about work stress, time factors, life pressures and everything, what you're going through every day. So this tool takes just minutes to complete, but can completely change your treatment direction. So, erections are a team effort between your body, your brain, and your relationship. Stress, worry, or mood changes can turn off the system completely that allow things to work naturally otherwise. So the best approach is one that addresses all of these issues. So we can help you regain confidence and function. So the bottom line is ED is just not a physical issue. It's a system issue. And when we screen properly, address performance anxiety, involve partners, and combine care, we just don't treat ED. We restore your confidence, we rebuild connection, and we change lives. So, if you are a physiotherapist or if you are a pelvic floor physiotherapist, start screening differently this week. If you're someone struggling, you should know this. There is nothing broken about you. Your system just needs the right approach. And if you're ready to take the next step, reach out to a team. We are providing male pelvic floor physiotherapy in some of our clinics, Instep Physical Therapy, Next Step Physio, Turning Point Physio, and West End Physio. Myself and my partners Jay and Neha, we are the male pelvic floor team, and we provide excellent male pelvic floor physiotherapy for you. And also we are coming up with a very nice program. I'll be releasing that very soon in one of our social media channels. And also you can book a confidential consultation if you want to discuss something over the phone with your pelvic floor physiotherapist. Let's rebuild your confidence the right way. This is Physio4U Podcast, where we don't just treat symptoms, we transform lives. See you again in the next episode. Take care.